Death surrounds us all. It's in a rusty nail, it's in the air we breathe, it's even in the water that we drink. Polio, hepatitis, and tetanus are serial killers to us humans. They prey on our brains, our organs, and our lives. However, with the aid of vaccines, we can stop these diseases right where they stand. Today, I'm going to tell you why vaccinations are so important and why they should be administered to all. Polio, hepatitis, and tetanus are a death sentence. Polio, according to the CDC, is a communicable disease that is spread from person to person. The virus works by attacking your brain and spinal cord, eventually leading to paralysis for the patient. Hepatitis is another deadly disease. According to kidshealth.org, the disease acts by attacking your liver. The virus comes in multiple strains and can lead to such things as liver cirrhosis, liver cancer, and even death. It can be more contagious than HIV and can mutate rapidly, lowering the chance for treatment. The last disease I would like to discuss is tetanus. According to the Mayo Clinic website, tetanus is a bacterial disease which affects your central nervous system. It can make it difficult to breathe. It causes muscle contractions and spasms, and it can lead to your death. All of these diseases are impossible or nearly impossible to treat. According to the polio eradication website, polioeradication.com, there is no cure for polio. They do, however, cite the safety and effectiveness of vaccinations. The medical journal medicalnewstoday.com provides some key insights into treatment for hepatitis. For example, the hepatitis A treatment has no treatment. Unfortunately for the patients, they must wait for their liver to recover itself. Hepatitis B is almost the same. However, if time proves ineffective, they will prescribe interferon, which is an antiviral. This is the story for most hepatitis treatments. Painful, clock-ticking time. And even that sometimes is unsuccessful. Tetanus as well has no cure. The Mayo Clinic notes that those who have not been immunized are at the highest risk of death. The treatment for tetanus is actually geared toward treating the complications and symptoms of tetanus until the toxin has either removed itself or the patient. However, you can prevent these tragedies from befalling your loved ones. For vaccination of polio, the CDC, an advisory committee of immunization practices, they recommend a schedule of 4 doses. The first and second doses are recommended to take place between the 2nd and 4th month of a child's life. The third dose is recommended to take place between the 6th and 18th month of a child's life. And the 4th and final dose is recommended to take place between 4 and 6 years. The CDC also recommends that vaccination for hepatitis occurs before the age of 18. The most common schedule is 3 injections into a muscle. They recommend that the second and third dose be administered within 6 months of the first. There are other dose schedules available, such as Recombavax HB, which consists of 2 doses that take place between 11 and 15 years, and Twirix, which can be administered in 4 doses over a shorter time period. The tetanus vaccine schedule for children, according to the CDC, should be 5 injections administered at the 2nd month, 4th month, 6th month, 15 to 18 months, and 4 to 6 years. The patient should then receive injections every 10 years to ensure safety. These diseases are all a risk to you and your family. One person missing a vaccine can create a domino effect of infection. These vaccinations are key to the eradication of disease. They are painful and deadly diseases, all attacking key organs in the body. With vaccinations, the spread of disease can end. If you have considered not vaccinating your family, I beg you to reconsider. Think of the pain and heartbreak you or your family would feel if your child were to contract one of these diseases. And then, think about the pain that your child will go through if they have contracted one of these diseases. I hope that I have accomplished convincing you all that vaccinations are crucially important. And if not, I pray for the health and safety of your loved ones.